Welcome to the future of teeth whitening. Here's our step-by-step guide on how to give your patients their whitest smile in just 16 minutes without causing sensitivity or rebounding. GLO's revolutionary closed-mouth system and patented technology is the best way to get your patients to smile. Before we begin, here's what you'll need. A fully charged device with autoclavable mouthpiece, in-office teeth whitening treatment kit and motivational teeth whitening shade assessment guide arranged from light to dark. Other materials to have on hand include handheld mirror, camera, saliva ejector, surgical suction, cotton rolls, mouth mirror explorer, cotton pliers, air water syringe tip, prophy angle, pumice, cotton swab, curing light, 2x2 gauze, bend a brush and safety glasses. Before we start whitening, here are a few really important things to know. The device must be fully charged for 5 hours before first use. To turn the device on or off, please double-tap the GLO button. Never disconnect the mouthpiece cord while the device is still on, as it could result in device failure. Ensure all lights are turned off from the device first. Let's get started. Step 1. Take pictures of the patient's smile with and without the starting shade tab in the photo. Step 2. Use fluoride-free paste to pumice the patient's teeth. It's an important preparation step for best results. Now is a good time to preheat the whitening mouthpiece before your first session by double-tapping the GLO button. The mouthpiece will illuminate. After your first 8-minute session, the mouthpiece will turn off and the yellow light will indicate the temperature is maintained while you prepare for your next session. Step 3. Carefully insert the cheek retractor so you can safely reach the teeth during treatment. Step 4. It's time to prepare the gingiva. Air dry the gum tissue on both arches, making sure it's pink, dry, and firm. Apply the gingival barrier to the gingival margin 1 arch at a time. Make sure to cover gingiva 4 to 5 mm from first molar to first molar and extend distal at least 1 tooth. If there's gum recession, please cover these areas and light cure immediately after barrier placement. Continue applying the gingival barrier to the next arch, air drying and light curing along the way. And finally, apply a thick layer of barrier along the incisal edge from premolar to premolar on the max and mandibular arch. Make sure no pink tissue is exposed around the teeth, and before whitening, please ensure that the gingival barrier is intact. Step 5. Place folded 2x2 gauze in the top and bottom lip vestibules and apply the lip balm generously. Firmly attach the mixing tip onto the dual barrier syringe and bleed a small amount of gel onto the bracket tray, which ensures an even mix. Step 6. It's time to apply the whitening gel. Evenly coat each tooth surface, isolated for whitening with gel, 2 to 3 mm. Evenly brush the gel across the top and bottom of the teeth. Use bend a brush to evenly spread gel across upper and lower tooth surface. Step 7. Carefully insert the mouthpiece one side at a time. The lip should not touch the mouthpiece or the whitening gel. Ask the patient to lightly close their mouth and to secure the mouthpiece. Step 8. Press the GLO button and start your first 8-minute whitening session. The control and mouthpiece will light up. Ask the patient to gently bite down and, when needed, insert the small suction between the mouthpiece and the cheek. The GLO control will count down your 8-minute session, and it will blink and beep when the session is ending. The mouthpiece will turn off automatically. Step 9. Remove the mouthpiece and use a surgical suction to remove the whitening gel from the teeth and the mouthpiece. Ensure the gingival barrier is still intact. With a cotton roll, wipe the facial tooth surface and the mouthpiece to remove any residual gel before reapplying. Step 10. Time for your next 8-minute session. Repeat steps 5 through 9. Remember, lips should not come into contact with the mouthpiece or the whitening gel. Press GLO button to start your second whitening session. When you hear the beep, your 8-minute treatment is complete. Carefully remove the mouthpiece, then remove the gel, the gingival barrier and the retractor, and clean the area thoroughly. Important: never disconnect the mouthpiece from the device while it is still on. Time for the patient to rinse their mouth clean and admire the results. Now you are ready to get glowing.